Hello everyone. So today we are going to see a letter which is somewhat confusing. That's what I have taken this letter to put it as a video, because there are so much collective data in this letter according to day 1, day 2, day 3. So we have to be arrange all these things, and we have to calculate the date, and we have to write it as a formative letter. That's what I have decided. So this is a bit tricky letter, so we will see. So now we are going to see a BERYL Casey letter. So we have received the case note. We are seeing the writing task. So using the information given in the case note, write a discharge letter to the nursing unit manager, the rehabilitation center, and waterfall. So this is a we are writing this letter to a nursing unit manager. So name of the receiver was not yet been given, so we have to write yours faithfully in the end of the letter. Okay, so we are writing this to the rehabilitation center. So by seeing just this word, we can came to know we are going to give a rehabilitative care to the patient. So waterfall. So we will go on to the body of the letter. Patient name Mrs. BERYL Casey, date of birth 21/11/1941. They have given is a 72 years old woman. So both age and date of birth had been given. We have to prefer date of birth because it is an accurate data. Woman who is being discharged from hospital to rehabilitation center. Okay, marital status is widowed recently. Okay, she is recently widowed, so we have to include. Family, 2 children, son lives locally and daughter inside. Okay, she have 2 sons, lives locally. Okay, doctor is interested, that is not needed. Social, lives alone in 2-bedroom house with stairs to entrance. Yeah, that is very important. She is a very old age and she is living in a 2 BHK house with stairs to entrance. Okay, son married, 2 children, lives 20 minutes away. So okay, both daughter and son is living apart from her. She is alone and she is also divorced. So we have to include in this letters because important. Son lives 20 minutes away, visit twice a week. Anyway, daughter is not going to visit, so we have to include in this letter. She enjoys gardening. We will see whether gardening is important or not. Medication, antihypertensive, Ramipril 10 mg. Currently she is giving 10 mg, getting 10 mg Ramipril. We will see. Admission date is 4/2/2014 at 12 o'clock. Fainting, getting out of the bed and fall to the floor, found by son 2 hours later. Yeah, that is important because he is having a fall to the floor and found by son 2 hours later. 2 hours later only they are saying. That is the thing happen. Okay, diagnosis. What is the diagnosis? Reason for the hospital admission. X-ray revealed fractured left neck of the femur. Okay, post fall. Okay, they have taken X-ray. It's revealed neck of the fracture have been broken. And what is the treatment? Left hemiarthroplasty they have done. This is the medical terms which is used for that procedure, which is not even we have to write letter in a simple format, so it is not needed. Under general anesthesia, incision closed with staplers into 2 into exudrain. We will see whether it is important or not. So this is the diagnosis. So what they have done in post-operation, intravenous IV therapy. What they have given, 3 units Paclitaxel with IV Laxis 40 mg. So post-operatively she have 3 units of Paclitaxel. Okay, it is a it got over. We will see whether it is needed or not. How we will they identify if in follow-up care, in the discharge care, if they are mentioning regarding this, we have to be connect this with that thing. So we will see after. Okay, with IV Lasix 40 mg therapy after each unit, intraoperatively and post-op. Okay, 3 units of RPRBC have been given intraoperatively and post-operatively. Okay, maintain IV fluids for 36 hours after seized and oral fluid is encouraged. All these things are got over things which is not at all needed. Okay, Intravenous antibiotic cefazolin 1 gram TID for 7 days. So 3 days course had been completed. That's what they, which is completed, which is not needed. Vital signs: BP hypotensive. Okay, she has some hypotensive and other observation within normal. She is having hypotensive. So antihypertension medication reviewed by Dr. Dose. Now ramipril is 5 mg. Okay, currently her ramipril dose had been changed to 5 mg. Previous dose was around, they have mentioned is that 10 mg. This is very important. Currently she is 5 mg. So previous mg had been, we have to mention, which is 10 mg. What is the reason? Suddenly she have gone to hypotensive 90/60. So this has to be followed in our notes, because she became, what is the reason? She become hypotensive. This letter is somewhat difficult or somewhat confusing. Let's see. Pain management: patient controlled anesthesia, PCA with fentanyl for 36 hours, pain relief satisfactory, which is pain relief satisfactory, that is for 36 hours, which is got over. Commenced oral analgesia 36 hours post-operative, tablet Panadol 4/24, 4 times a day, maximum dose of okay, for 24 hours. Okay, now she is currently on, okay, she is post-oral analgesia. After fentanyl, she had been started with Panadol for 36 hours. That is also got over. Okay, which is not needed. Wound management. See, this is for first 3 hours, 3 days. 24 hours means 1. This is for first 2 days, and this is for next 2 days. Total days 4 days. This is for first 4th day, 4 days. Okay. Currently we are in discharge date. We are in day 7. So up to day 4 it is. So which is not needed. Okay. Wound management. Dressing they have given. Okay. Total 600 ml hemoserosanguinous fluid. Discharge from exudates over 24 hours. That is not needed, which is around in the post-operative day. Drain tube removed, which is not needed, which is in day 2. Alternative staples, because we are writing it is to rehabilitative care. What they have given is not important. What rehabilitative team has to do, we have to mention in this letter. Okay. Alternative staple removed 5 days and dressing changed. 5th day. In 5th day, dressing changes. Okay. Mobility and activities of daily life is encouraged. What happened? Okay, what happened in day 2? Sitting out of bed, short period, full assistant, not needed. Mobilizing with pickup frame and 2-person assistant. Okay. Regarding mobilization, we have to write in day 2 she is sitting, and day 3 she is mobilizing. This we have to mention. Mobilizing short distance with the help of pickup frame and 1-person assistant. Okay, finalizing means with 1-person assistant, abduction pillow when resting in the bed. So this is the final rehabilitative details, which is, so this thing is not needed. This thing is not needed. In day 5 she is mobilizing with 1-person assistant. Okay. So anti-embolic stocking in situ for 14 days, ADLs, full assistance. So activities of daily living is with full assistance. So they have suggested anti-embolic stocking in situ for 14 days. So they are starting the anti-embolic stocking in 5th day. So only 2 days had been got over. Day 5 and day 6 had been over, remaining 12 days. So in day 7 we are getting discharged. So remaining 12 days we have to get a follow-up. While writing in the letter format, remaining 12 days we have to follow. Are you getting me? Because in day 5 they are starting. We are writing this letter in discharge date. Okay. So 1-2 days they have been finished. So remaining 12 days, because they have been suggested for 14 days. So remaining 12 days we have to be suggested. Okay. Uneventful days preparing for the discharge. Okay, this is the day preparing for the discharge. This is the discharge day. Day 7 is discharge days. So I will calculate the days first, then you will came to understand. So 4 they are getting admission. So in 4th itself they are doing emergency surgery. So 5-2 is post-op day 1. This is the details of post-op day. Okay, this is the 5-2 details. So this is 6-2, 7-2, 8-2, 9-2, 10-2. This is 11-2. 11th February is our letter date. Okay, this is 12-2, 13-2. So our discharge date is 12-2. So discharge medications are Ramipril 5 mg. Currently she is on 5 mg. Paracetamol 1 gram QID if necessary, 4 times a day if necessary. Family to be noticed for transfer. Okay, this is important. Noticed for transfer, and hospital transfer arranged for 11 o'clock. So 11 o'clock they will be getting discharged. So after discharge, what is the plan? A repeat check of hemoglobin level, monitor BP 2 times a day for 3 times a week due to adjustment in antihypertensive medication. This is week. This is number of 3 times a week. Okay. Alternatively, we have to check the BP twice a day because change in hypertension. So this is the discharge plan. So we have, because why we have to check the hemoglobin, so that we have to include this data, because post-operatively she have been 3 packs, 3 pint PRBC they have been administered intraoperatively and post-operatively. So we have to be include this medication. Okay, so then we have to include the data. Assess for rehabilitative therapy inpatient. Okay, we have to give rehabilitative therapy in inpatient on return home also. When in their center also they have to give rehabilitative assessment, and if she is getting discharged also they have to get rehabilitative assessment, because we are encouraging. Removal of remaining staples wound. Remaining staples wound can remain exposed afterwards. Okay, so in day 5 they have removed staples. Alternatively, somewhere they have been mentioned, no, alternative staples removed day 5 and dressing changes. Okay, so remaining in between staples they have to do in day 10, that is after 2 days. This is after 2 days, and the wound can be remain open. This is a bit confusing letter. We will see while writing this letter within approximately 180 to 200 words. This is the important things which we need to be written in this letter. Remaining things are no needed. Okay, shall we start writing the letter? Yes. This is the main exam letter. We'll start writing the letter. So first thing, we are writing the discharge date. What is the discharge date? Day 7. Day 7, that is 11/2 is the discharge date. So 11 February 2014. To whom we are writing? The nursing management, the rehabilitative center, waterfall. This the is not needed, this the is needed. Okay, leave one line. The nursing manager rehabilitation center waterfall. So leave one line. Dear sir or madam, because the gender was not revealed. So regarding to whom we are writing, Mrs. BERYL Cassie. So date of birth they have given. If they have mentioned only age, we will use comma and we have write age. In this only date of birth they have been mentioned, we have to write date of birth in second line. Date of birth 21 November 1941. So you will be writing in pencil in this your OET answer sheets. So not a problem. We will have a eraser. So we will write the purpose paragraph. Always the purpose paragraph should contain what to do, why to do. What is the purpose of the letter? We are referring the patient to rehabilitative for rehabilitative management. And why to do? Because she is recuperating after a left hemiarthroplasty procedure. That is the reason. Simple. I am writing this letter to refer Mrs. full name we have to write. BERYL Casey, who requires rehabilitative care and management. This is at your facilities. Okay, because we are referring the patient to their center, so this is at your facility. Okay, if someone is visiting the patient and giving the care, means that is at your service. Okay, so in this letter it is at your service because she underwent. Okay, she is recuperating. If surgery means we will write recuperating after a left hemiarthroplasty, and she is discharged today. Okay, this is the purpose paragraph. So we will see the expansion of the purpose paragraph. What we will write? So we will be writing this thing. Okay, Mrs. Casey was admitted to our facility on 4 February 2014 following a self-fall. Okay, she was, we have to write because she was unattended for 2 hours. She was unattended for 2 hours. Subsequently, what we have done? So subsequently we have, after coming to emergency, subsequently a X-ray was taken which revealed fracture left neck femur. So what we have done? Therefore she underwent an emergency left hemiarthroplasty surgery. Okay, this thing we have done. So up to this we have written. Then what is the next thing? 3-point PRPC they have been received. So we are mentioning in there. Moreover, this is an additional thing. Moreover, she was past tense transfused with 3 units of packed cells during and post surgery. We should not use medical jargons. Intraoperatively, post-operatively, during and post surgery. Simple words we have to use. So what is the so they have been transfused. We can connect this rehabilitate. We can connect this hemoglobin. So repeat the hemoglobin levels. Therefore, we will connect. Therefore, it is important to check her blood hemoglobin level tomorrow, because they told to check the hemoglobin level in day 8. Okay, we are in day 7. So that's what I have written, tomorrow. So that is the main trick of this letter. Okay, then what is the thing happened next 36 hours? Fluid orals, that is not needed because that is a post-operative orders. Intravenous antibiotic which is completed, and yeah, this is very important. Next thing is hypotension and ramipril dose, which is alternative, which is changed. We have to be return in this during hospitalization thing, and we have to connect this point also. Monitor BP for due to adjustment in hypertensive dose. Okay, we can write this point in this during the hospitalization. So what we will do, during hospitalization, she has decreased BP, blood pressure. No hypertensive we have to write, decreased BP. As a result, her medication ramipril 10 mg was is reduced to, because it's still continuing, reduced to 5 mg. Kindly monitor her blood pressure twice a day for next 3 days due to change in dose of anti-hypertensive drugs. So this is the first paragraph. So what is the next? This letter is a very big letter. Hospitalization we have been in. Still current details we have to write. Okay. What is the current detail? So all these things was not needed. So sitting out currently some details we will write. Okay. So in this social history will not come, past medical history will not come because they haven't mentioned any of these things. Okay. So we will write. Presently, this letter is completely of present details. Presently, Mrs. Saisy can ambulate. So all these things we are leaving. So we are present condition we are writing. Mobilizing short distance. Okay. Can able to ambulate a short distance with a help of pickup frame with one person assistance. Okay, even though she is able to mobilize, ADLs was activities of daily living with full assistance. So we will use connected. However, because but, however, no comma, however, yeah, however, comma, she requires full assistance to perform the activities of daily living. Okay, so we have finished this thing. We have finished. Yeah. One thing, this stapler removed, no, that thing we will write. Then only we can able to connect to this point. Which pointer? Alternative staples should be removed. Okay, we will connect this point. That is an important point. During recovery period, during recovery, her alternative staplers were removed with dressing were performed. Okay. During recovery, her alternative somewhat, see, while writing this letter, for me it's getting confused. There is not even a single point of doubt. When you are a freshers who writing a OET this kind of letter, it will be getting so much confused. Not to be worried. If you are practicing more than 15 to 20 letters, it will be getting okay. So during recovery, her alternative staplers were removed with dressing during some kind of grammar mistake was there. During recovery, her alternative staplers removed and dressing was performed. Okay. Her alternative staplers were removed and dressing was performed. In addition, her, we will try connect the remaining, her remaining staplers to be removed after next 3 days and wound can remain open. Okay, this is the thing which is very difficult to connect. Remain open. Okay, so we have connected, many connectors are there in this letter. So we have connected staples mobilizing with the PUF, then 1% assistant. Yeah, ADLs, all the thing is pending. I mean, pendings are completed. Yeah, this thing we have abduction pillow when resting in bed. Okay, we have. Okay. She requires abduction pillow when resting in bed. If you want, you can write off note because it is a note. Okay, off note, she requires abduction pillow when resting in bed. So this is the final thing. Okay, then regarding anti-embolized talking also we have this thing we have. See, if you are not getting underlined, no, we will be forget what we are going to write. Okay, so I have forgot to underline. So what the thing currently, so in this we have written presently, starting of the paragraph. So currently she is on anti-embolic stalking which need to be continued for next 12 days. See, always we have to write in alphabeticals, not in numbers. Okay, so this paragraph is over. Then we have to going to discharge plan paragraph. So discharge to rehabilitation center, Ramipral 1 mg. Okay, paracetamol 1 mg, this is pending. Paracetamol is pending. Hospital transport not needed. Hemoglobin we have written. Antihypertensives also we have written. Remaining staplers also we have finished. Rehabilitative therapy and inpatient on return home. We have to remind the staffs regarding that, as is the rehabilitation therapy and paracetamol dosage. That is the two things we have to write in this discharge file. It would be appreciated if you could assist for assist for rehabilitation, rehabilitative therapy during inpatient and when she returns to home. Okay, then please continue paracetamol 1 gram, 4 times a day if necessary. Okay, so if you have any queries, please do not hesitate to contact me. Yours faithfully. So we are a charge nurse, so registered nurse. So please be neat while writing the letter, and in OET case note also you are writing in pencil. Please use light form of pencil which is not too dark. Okay, 2B pencil is only pencil allowed in OET letter. Please write lightly in the note, not to be dark, so dark. So if you are getting erasing, it is very difficult for you to getting the presentation very neatly. Okay, so because you are writing in a pencil, it is very easy to correct if it is at the end of the final letter also. Okay, so this is my letter. For me it is very difficult to write this kind of letter. Okay, so not to be proud, some if they are planning to make the writing part so difficult, so they will give all these kinds of case notes, because it is a very time consuming, because we have to use many connectors, we have to connect many sentence. That's what some people will find very difficult, and lots of time will be wasted in this kind of letter. And main thing is the letter will not be fulfilled with proper sentence. That is the very important thing while we are writing this letter. Okay, so thank you. This is a very somewhat confusing letter. Please practice this kind of letter also in your OET preparation. So we will see you with another type of letter. Thank you.